All over the world and even in our country, the most widely known technique for breast reduction surgery is specifically the technique referred to as the inverted T technique. At the beginning of this speech, I especially want to emphasize this. The inverse T. I avoid using the inverted T technique. I do not want to use the inverted T technique in my surgeries. Beyond this, the other primary techniques utilized, particularly in breast reduction surgeries, involve reductions made around the nipple area, the second category being the surgeries involving a vertical incision extending downwards from the nipple. When the patient's examination results fit this technique, these two methods heal up super well regarding scars. We typically use the incision around the nipple in cases where the breast size is not excessively large or the degree of sagging is not too pronounced. And approximately 2 to 3 months following the operation, these incisions fade to become almost invisible. When 9 months to 1 year passes after the surgery, we can almost not find these scars. We cannot even find them 99%. The next step up involves cases where the breast size is somewhat larger and there is a greater degree of ptosis around the nipple and with a vertical incision downwards. I prefer techniques that will result in this. In these techniques, just like the one around the nipple, after the surgery, 9 months to a year later, the scars become faint. Some patients even heal better than 99%. So we can offer these to you as Scarless techniques too. To you all. A step beyond this, in cases where the sagging is a bit more pronounced, where the breast tissue is a bit larger, is where I prefer to perform these surgeries with an incision around the nipple, a vertical incision downwards, and a small short incision under the breast. This technique, in our aesthetic surgery applications, it is called a short T. The incision in the inframammary fold is almost as if from an inframammary fold, a breast implant. It is a small incision, as if placing a silicone prosthesis, and this also makes patients very, very happy in terms of scarring. The result is an almost invisible scar. I want to return to what I said at the very beginning. I dislike the inverted T technique and I try to refrain from using it whenever possible. Naturally, apart from this, in breast lift operations, as I just mentioned, we can perform them using an incision around the nipple or a vertical cut descending from the nipple, and these heal very well. You will have almost no scar issues. We can offer scarless breast augmentation techniques 99.9%. Specifically in our augmentation procedures where we insert the silicone implant via the axilla, after 9 months to a year has elapsed, perhaps even for the incision we made for the operation, I might not even be able to find the scar. However, for this outcome, your clinical examination findings must specifically align with the axillary approach. The silicone prosthesis to be used must be appropriate for your examination findings. But I believe that just being aware that such an option is available will be a huge benefit for you. It will represent a significant advancement. In addition to this, if your examination findings are suitable, we can place the silicone prosthesis through the belly button in breast augmentation surgeries. Although it is technically a bit more, even if it is difficult, if your examination findings still match this, the silicone prosthesis through your belly button can be scarless. We can place it. Besides these two scarless techniques for silicone prosthesis placement, meaning breast augmentation surgeries, we can place silicone prostheses around the nipple or through the inframammary fold. Because we exercise maximum diligence here and close our incisions using aesthetic, absorbable, hidden sutures, I can state that the likelihood of you encountering any problems related to scarring is practically zero. Ultimately, whether we are performing an augmentation, a reduction, or even a lift procedure, we do. Watch. We care about the problems you will experience more than you do, and we are trying to perform all these surgeries with scarless techniques to a minimum. Scarring techniques. We make an effort.